So now we're going to talk about both restless leg syndrome and also leg movements during sleep as well. Restless leg syndrome is a clinical diagnosis. There's symptoms that we feel, that we discuss with our doctor. And it's uncomfortable sensations in our leg, a irresistible urge to move them. It's worse at night, it's worse when we're resting, and it is relieved by movement. Now, one of the problems is that kids, they don't speak our language, so they don't tell you these classic 4 symptoms. They'll tell you other things. They'll say that their legs have owies, or that it itches, or they'll ask for their legs to be rubbed during the evening. They'll use words like Coca-Cola bubbles, and this can be a sign of restless leg syndrome. Now, there have been times that they have been confused for growing pains, although generally growing pains can happen day or night, and they happen a little bit more with a lot of activity. Restless legs is more night specific, and when you have inactivity, when you have less activity, is when you start to feel some of these symptoms a little bit more. Now, a lot of patients that have restless legs can also have leg movements, but you don't always need to have restless legs to have these leg movements that we may or may not be aware of. In periodic limb movement disorder, you have limb contractions resulting in repetitive jerk of the toes or feet, and it can actually even be of the arms as well. Now, it can lead to arousals or sleep disruption, but sometimes it can be normal as well. And I know that sounds vague, but let me show you 2 examples. Now, in this example, you see that the person is kicking their legs all night long, but look, there's no brain disruption. This person is sleeping right through it. This is someone who you don't want to share a bed with if you're going into a hotel, but it's not bothering them. They are in a deep sleep when this is occurring, as opposed to this example, where you can see that the person is kicking and it's either frequent enough or it's forceful enough to where you can see that it's causing some brain disruption. And believe it or not, actually 75% of kids that have this can have some daytime ADHD symptoms. A lot of adults that have this will complain of fatigue during the daytime, and they may even complain of insomnia, saying that they feel like they haven't slept during the evening because they have a disorder that is causing sleep disruption. So just one side note, trying to get back to where I was saying of what do I think about melatonin, I always say, what are you treating? For example, melatonin isn't going to treat a sleep apnea or restless leg syndrome. A lot of the over-the-counter products contain antihistamines, and those will actually make a restless leg syndrome worse, or a leg movement disorder worse. So it's always important to know exactly what it is you're treating before starting different medications.